So from the patients for patient safety, let's move on to the hospitals of tomorrow. इंफ्रास्ट्रक्चर को लेकर बहुत सारे देश में तमाम बहुत सारी गतिविधियां, बहुत सारे काम, बहुत सारे आगे जो जर्नी है वो चल रही है, लेकिन उसको लेकर क्वालिटी एश्योरेंस और क्वालिटेटिव जो बदलाव है, चेंज है, उसको इंश्योर करना भी बहुत ज़रूरी है। और इसीलिए इस सेशन को हमने ख़ास तौर पर रखा। इसके बाद हम क्वालिटी एंड एक्रेडिटेशन वाला सेशन भी करेंगे। तो डिफरेंट एस्पेक्ट्स को अलग अलग सेशंस में एक डिस्कशन के माध्यम से, शेयरिंग या एक्सपीरियंस शेयरिंग के माध्यम से हम आपके सामने रखना चाहते हैं, सो दैट वी कैन बी बेनिफिटेड फ्रॉम ऑल दीज एक्सपीरियंसेस एंड the comments. So in this session we will be having the guests and dignitaries from different fields, but before that एक announcement आपके साथ हम आपके सामने हम ज़रूर करना चाहते हैं। गवर्नमेंट ऑफ इंडिया, मिनिस्ट्री ऑफ हेल्थ की तरफ से एक सर्कुलर जारी हुआ है, वो आप सब तक भी पहुंचा होगा। आज से लेकर 1 अक्टूबर तक, 1 अक्टूबर मीन्स दैट इज़ नेशनल वॉलंटरी ब्लड डोनेशन डे। वी सेलिब्रेट एवरी डे दैट डे एज ए नेशनल वॉलंटरी ब्लड डोनेशन डे। और उस दिन तक ये ब्लड डोनेशन, एक मेगा ब्लड डोनेशन जो पखवाड़ा है, उसकी शुरुआत आज से हो रही है। और आज इसको बहुत बड़े स्तर पर, आज का टारगेट ये है कि 1 लाख लोगों का जो ब्लड डोनर्स हैं, उनसे ब्लड डोनेशन के माध्यम से हम ब्लड को इकट्ठा कर पाए। सेफ ब्लड भी हमारे हेल्थ सिस्टम में बहुत बड़ी भूमिका निभाता है। और ब्लड डोनेशन के माध्यम से आप जानते हैं बहुत जगह बहुत सारी प्रॉब्लम्स भी हैं, क्योंकि अवेलेबिलिटी ऑफ ब्लड जो है वो कई बार दिक्कत होती है। तो आज 1 लाख का टारगेट है और 1 अक्टूबर तक हम इस मिशन को, इस कैंपेन को जारी रखेंगे। तो आप सभी इसमें जितने हॉस्पिटल्स हैं देश में, गवर्नमेंट के, स्टेट गवर्नमेंट्स के, यूटीज़ के, प्राइवेट हॉस्पिटल्स, हेल्थ केयर से रिलेटेड कितने भी जो भी ऑर्गेनाइजेशंस हैं, जो भी प्लेटफॉर्म्स हैं, उन सबको ये रिक्वेस्ट की गई है कि वो अपने अपने क्षेत्र में ब्लड डोनेशन कैंप ज़रूर लगाएं, क्योंकि इस समय की एक बहुत बड़ी ज़रूरत है ब्लड को, सेफ ब्लड को कलेक्ट करना, उसको और पेशेंट्स को उसका लाभ मिले। So now the stage is ready for the next session. So I will be inviting first the moderator, then all the panelists, and let's invite the moderator of the session, Mr. Abhishek Gopalka. I will request him to please come on the stage. तालियों की आवाज़ आप सबकी तरफ से खूब सारी आनी चाहिए, so that from the very beginning we feel that energy. Moderator Mr. Abhishek Gopalka. Mr. Gopalka is a managing director and partner in Boston Consulting Group's New Delhi office, specializing in social impact and public sector practices with over 11 years of experience. His expertise spans governance, public health, education and more, with previous roles at Booz & Company, IBM and Wipro. The academic credentials from RV College of Engineering and the Ross School of Business. We welcome Mr. Abhishek Gopalka. Then as a panelist, we have Dr. Kaustubha Upadhyay. Dr. Kaustubha Upadhyay is MD in Dravya Guna, is the head of the drug policy section of the Ministry of Ayush, Government of India. As an expert in Ayurveda, he advises on drug policies and regulatory matters. Dr. Kaustubha Upadhyay, I will request him to be honest. So he's just joining in 2 minutes. We have in this session Mrs. Gracie Mathai. Mrs. Gracie Mathai is CEO of Baby Memorial Hospital, Calicut. Holds extensive qualifications and experience in healthcare management, including roles at Aster DM Healthcare and Leelavati Hospital. Aapki Kattal Dhwani with a huge round of applause. Let's welcome Mrs. Gracie Mathai also. She is a certified Six Sigma Green Belt, lead auditor for ISO, and has received the FICCI Award 2023 for excellence in healthcare leadership. Then we have Dr. Anurag Agrawal in this session. I will request him to please join on stage. Dr. Anurag Agrawal, Dean of Biosciences and Health Research at Ashoka University, is a leading expert in respiratory biology and healthcare technology. Formerly the director of the Institute of Genomics and Integrative Biology. He has chaired global advisory groups, including the WHO Technical Advisory Group for SARS-CoV-2. शांति स्वरूप भटनागर सहित बहुत सारे बड़े बड़े सम्मानित पुरस्कार आपको मिले हैं, डॉक्टर अनुराग अग्रवाल. देन वी हैव डॉक्टर संतोष शेट्टी. आई विल रिक्वेस्ट हिम टू प्ले, आई विल रिक्वेस्ट डॉक्टर संतोष शेट्टी टू ज्वाइन ऑन स्टेज. With 25 years in hospital operations, Dr. Santosh Shetty, Executive Director and CEO at Kokilaben Dhirubhai Ambani Hospital, ladies and gentlemen, he has been instrumental in establishing KDAH Mumbai as a leading healthcare facility. His visionary leadership has maintained KDAH's top position in Western India for 8 consecutive years. 8 साल लगातार टॉप पोजीशन में आपकी लीडरशिप में हॉस्पिटल रहा है. इस तरह की कंट्रीब्यूशन आपकी इस फील्ड में रही है. Then we have Shrimati Meenakshi Nevatia. I will request Mrs. Meenakshi Nevatia to please join us on the stage. Mrs. Meenakshi Nevatia, MD and Country President at Pfizer India, brings nearly 30 years of leadership experience from top firms like McKinsey and Company, Novartis, Stryker. With a notable 15-year tenure at Novartis and significant roles across multiple countries, she holds an MBA in Strategy and Finance from IIM Ahmedabad and a Bachelor of Science in Economics and Mathematics from Presidency College, Kolkata. Ms. Alka Goyal, I will request Ms. Alka Goyal to please join us on the stage. So Dr. Deepak Singla, I will request Dr. Deepak Singla to join us on the stage, and he is a medical director, Maharaja Agrasen Group of Hospitals. He has experience of more than 40 years in this sector, ladies and gentlemen. He is a master trainer and effective communicator, certified data scientist and certified Six Sigma in Black Belt. तो आइए इन सब का वेलकम करते हैं. इन सब के लिए आपकी करतल ध्वनि, आपकी तालियों के साथ इनका अभिनंदन वंदन. थोड़ी और ऊर्जा चाहिए, एनर्जी चाहिए, जरा जोरदार तालियों के साथ वेलकम करें. So Dr. Kaustubh Upadhyay is here. I will request him to please join us on stage. Dr. Kaustubh Upadhyay, MD in Dravya Guna, Head of the Drug Policy Section of the Ministry of Ayush, Government of India. So Rizwan Koita Sahab, I will request you to please come on stage. Chairperson NABH and Dr. Atul Mohan Kochar, CEO NABH. हमारे इन सभी पैनलिस्ट को यहाँ पर एक प्लांट भेंट करके आपकी ये प्लांट हमारी कमिटमेंट है एक ग्रीन अर्थ के लिए. तो आपकी तालियों के साथ इनको हम वेलकम करना चाहते हैं, इन सभी हमारे गेस्ट्स को जो कि इस सेशन में हमारे साथ होंगे. और इस सेशन में हॉस्पिटल्स जो आज तो हैं लेकिन कल के लिए भी हमारी ज़रूरतों के हिसाब से पॉपुलेशन बढ़ेगी, रिक्वायरमेंट्स बढ़ेंगी, एक्सपेक्टेशंस बढ़ती हैं और पूरी दुनिया आज इंडिया में, भारत में हेल्थ सेक्टर में अच्छे हॉस्पिटल्स, अच्छे ट्रीटमेंट के लिए वो आना चाहती हैं. तो इस तरह से इंफ्रास्ट्रक्चर के साथ साथ एम्प्लॉयमेंट जनरेशन में भी बहुत बड़ा एक रोल है इस सेक्टर का, और उसमें हॉस्पिटल्स अपने आप में एक बहुत बड़ा हमारा एक सेक्टर है, एस्पेक्ट है हमारे हेल्थ केयर का, पेशेंट सेफ्टी का, और उसको लेकर इस सेशन में हम खास तौर पर चर्चा करेंगे, जिसमें हमारे ये सभी डिग्निटरीज यहाँ पर मंच पर होंगी. थैंक यू रिजवान साहब, थैंक यू डॉक्टर अतुल मोहन कोचर. एक बार आगे वी विल हैव अ ग्रुप फोटोग्राफ so that we can frame it later on, और उसको एक फ्रेम के तौर पर आपको हम दे सकें आपके स्मृतियों में, मेमोरीज में, आपके घर में वो फोटो हमेशा इस कॉन्फ्रेंस की आपको याद दिलाएगी. और जब भी इस कॉन्फ्रेंस की याद होगी तो पेशेंट सेफ्टी को लेकर हम ज़रूर याद करेंगे कि हमारी कमिटमेंट और हमारी रिस्पॉन्सिबिलिटी क्या है. सो थैंक यू वेरी मच, वी वेलकम ऑल ऑफ यू. थैंक यू रिजवान साहब एंड डॉक्टर अतुल मोहन कोचर. और मैं नाउ आई विल रिक्वेस्ट द मॉडरेटर ऑफ द सेशन, Mr. Abhishek Gopalka, please start the proceedings of this session.
Thank you so much and welcome everyone. It's fantastic to see the kind of energy in the room. So congratulations to each of you as well. The topic that we wanted to discuss in today's panel is really the hospitals of tomorrow. So we wanted to shift from the conversation around today and the near future and really look beyond and say what should hospitals of tomorrow really look like. It's an esteemed panel, as you can see. We have representation from the Ayush Ministry, from hospitals, pharma, academia, so it's very multi-stakeholder in the way this panel has been constituted. And that's exactly what we want to do when we want to think about hospitals of tomorrow. once we start thinking about hospitals of tomorrow, as I introduce the panelists, there'll be multiple trends that we'll be thinking about. In the last panel, there was a lot of discussion around value-based care. How can hospitals be selected on the basis of data, whether it's data on patient safety, data on patient quality? All of us choose restaurants and food and other such features every day on our apps. Can that be extended to hospitals? So can there be value-based care in hospitals? Has the time come for that? Population health management, whether it's dengue right now, COVID earlier, NCDs, can the role of hospitals shift from being facility-centric to being population-centric? And what can the role of digital be in enabling that shift from being facility-centric to population-centric, whether it's digitization of healthcare or actual digital service delivery? And all of that is made much, much more possible through digital. And then finally, what can India do for the world? We are talking about Viksit Bharat. We are talking about an era where India can contribute to the global south, to the world, and therefore whether it's R&D opportunities, medical value tourism, training healthcare professionals for the world, what more can India's hospitals do? What more can our hospitals of tomorrow look like? So that's the kind of context for our panel. Without any further ado, I'm going to request Dr. Upadhyay to get us started on the topic of Ayush. How can Ayush be mainstreamed into the hospitals of tomorrow? How can that really be one of the big contributions of India to the world? Dr. Upadhyay.
Thank you. See, how Ayush hospital for tomorrow. Tomorrow will be based on the policy we are going to take on today. Tomorrow is decided how we'll plan for today. So we have a vision to be developed country by 2047, Viksit Bharat. That is the goal for all of us citizens of country by our Honorable Prime Minister. So how to achieve to be developed countries? To attain developed countries, we should meet the standards where all other developed countries are meeting as on today. So for that, we have to upgrade ourselves. So Ayurveda, yoga are the indigenous strength of our country. We are dwelling on the strength of Ayurveda and yoga. We want to promote it as a soft power across the world so that this is our strength. We have to showcase our strength to the world. So that is the policy. So our National Health Policy 2017 is aimed at mainstreaming of Ayush in general health services. So how to do mainstreaming? Mainstreaming, there are many ways. We have different models of mainstreaming of Ayush. For example, All India Institute of Ayurveda, where we have state-of-the-art diagnostic facilities where patients across the country can come over and get their diagnosis on the basis of modern technology, but their treatment will be based on Ayurveda, where both the systems, doctors of both the systems are there in the facility. Patients will get diagnosed by modern doctors and they will choose optimum Ayurveda treatment for their illness. This is IA model. We have one more model at NIMHANS. NIMHANS model is patient-centric, where patient will be diagnosed by a team of doctors, where there will be psychiatrist, psychologist, Ayurveda expert, yoga expert. All together, a team will consult the patient together at a time, and after talking to patients, they will discuss themselves what is the mutual strength, and then they will give the choice to the informed choice to the patient. See, these are all the strengths of each system, and we want to have psychiatry this option we have, yoga this option. So patient will be given choice, and all the systems together will treat the same patient for the common benefit of the patient. This is NIMHANS model. Now, we have one more model, AIMS model, where the experts of both the systems, conventional system and Ayurveda and Ayush systems, they sit together, they will discuss together, they will decide what protocol to be adopted for the benefit of the patient. So to decide on the protocol, they will conduct a study where taking the strengths of each system, and they will verify it. They will examine whether this model will be suitable for the patient, and based on their experience, they will design, this is the integrative model which can be adopted for the benefit of patient, which can be adopted across the country. That is the AIMS model. One more model, NHM model. NHM model, where co-location is the key. It is a cafeteria approach. Patient will be given choice whether you want Ayurveda, you want allopathy, you want yoga, you want Siddha, whatever the system of your choice. We will give you facilitation at the same premises so that patient will choose whatever the treatment of his choice as per their experience and their inputs. This is NHM model. So government is not only mainstreaming Ayurveda, now we are focusing on scientific evidence creation. See, these Ayush systems are there from time immemorial. They are having its own strength, everybody recognizes, but there is no sufficient scientific evidence on record. So that is the lacuna where people from other systems are not yet confident that whether this can be advised to all patients, whether these evidences are enough to take these systems further. So further, government is keen that Ayurveda should be promoted on the basis of evidence. So generation of evidence is the key for promotion of Ayush. How to generate evidence? So whatever the Ayush experts, as per their systems, they will design the protocol. Modern scientists will apply their research methodology, and with common research methodology, whether how the Ayush treatment, Ayush intervention give the output. This is how we will create the evidence. Once the evidence is generated, it will be publicized in the international journal, reputative journal, so that all scientific community can accept it as a evidence which can be taken on record and which can be tried on other patients across the world. That is the concept of evidence generation, then research and development. Actually, as on today, we are only following 2% of what is told in these systems. Not all the science which is told in the classic books are in practice. This is because of generation gap, and those practices are not tested properly as on today. If we, without bias, if we encourage scientists from both the streams to come and discuss mutually, we will have lot of opportunity. In future, now only all the center of excellence you may be seeing in IITs, AIMS, Indian Institute of Science, ILBS, NIMANS, all the apex institutions of the country, they have center of excellence in Ayush. What they will do there? For example, microbiota, there is study related to Ayush Prakriti. Genomics, there is a study related to Ayush Prakriti. And in future, you may be having a situation where genes are classified as per doshas, Vata, Pitta, Kapha, doshas. So there is a Vata predominant genes, Pitta predominant genes. These can be identified. Antibiotics, viruses, they can be classified according to doshas. So if you open up these flora, these research problem, there is ample opportunity to support the current conventional system, so that which antibiotics has to be prescribed to which patient. You can have inputs based on Ayurveda outlook. So these possibilities are possible in future hospitals. You will have all modern hospital now, even in private sector also, so many hospitals have come out with Ayush integrated centers. I hope by next year, all of us will have our own Ayush centers in our hospitals. That's the expectation from all of you. Thank you all.
Thank you. Thank you so much, Dr. Upadhyay. Very inspiring, and completely fingers crossed that that journey of mainstreaming will get expedited. Professor Agrawal, I'll turn it to you next. Professor Agrawal needs no introduction, has also played a critical role during India's fight in the pandemic. Professor Agrawal, if you can highlight a couple of points more around R&D opportunities, the move towards value-based care, would love to hear your thoughts.
Sure, thank you very much. As we heard, a future hospital will be driven by transformation in the science, but a lot of what will come will be transformation in everything digital that's occurring. If you look back at history, the modern hospital doesn't emerge until about 1930. The idea of a modern hospital was to concentrate scarce resources. And that is what drives the formation of hospitals. Things that are scarce, difficult to access, are brought together in one place so people can come there. Now, what's going to happen because of R&D, particularly in the world of AI and digital? Things that were scarce may no longer be so, particularly in the world of consultative systems, where between digital, online, virtual consultations, you will see a variety of things for which people had to come to a physical location, decentralized. And we have seen this happen in Estonia. In Estonia, a lot of healthcare has shifted to community away, and the number of hospitals actually has gone down, hospital care. But on the other hand, science moves forward. New things come that cannot be done in the old way, and people will continue to come to hospitals for that. But I think what's the biggest transformation that will come will be value-based care. You heard an example about Zomato and star ratings and our choices. But that also has to do so much with price point. A high-priced hospital that provides very good care but not to satisfaction might get rated poorly by somebody who's just putting stars on it. A continuous generation of evidence encapsulated in the records. What works, what does not work, we do not know actually. Medicine keeps changing all the time. But hospitals will become the site of data, research, evidence generation, and a truly holistic sense of what works for the community. I would actually say that hospitals, especially driven by the private sector, will also bring in very important economics. What works? How many people do you need to treat to get one person to benefit? And what was the cost for that one person to benefit? All this will be seamlessly derived in a future hospital, driving evidence for care. I'm going to stop here. I'm sure there will be more opportunities.
No, thank you so much, Professor Agrawal. Very inspiring. Ms. Patai, I'll turn it over to you next. Wanted to bring back the human element also, in addition to digital that we've been talking about, the role of the nurse, if you will. It's always been a vital role. As we think about the hospitals of tomorrow, how do you see the role of the nurse evolving in the future?
Warm good morning to each one of you. I'm standing here on behalf of the nurses, those who are presented over here, and the nurses represent our country, though I am working as a CEO at the moment. Now, the question is where you and I will be in the future healthcare. When I was thinking into my own mind, and I thought there's a great opportunity, there's a great place, different place where you and I will be there. In our last talk, we heard about patient-centered care or patient involvement. So I would like to emphasize over here that the involvement of the patient and the patient-centered care in the organization will be more emphasized and more brought by the nurses in future. It's not only looking into their medical aspect, but also looking into their physical, emotional, as well as social aspect. The next thing what is coming to my mind is that the nurses will be the leaders for patient safety and quality, as it is already there. Whatever said and done, the nursing fraternity is always in front for ensuring quality as well as patient safety. Though we have n number of other categories of people, but the friend and always accepted and the challenge is accepting person is mainly the nurse, that you will agree with me. And the third which is coming to my mind in future is the nurse is going to be a collaborator and as well as a binder towards a multidisciplinary action which need for the patient safety in future. So here, she will act as a central person who will be collaborating with all other healthcare personnel, like various departments, various specialties, and bringing a unified action for the betterment and safety of our patient. And of course, the greatest part is the outcome. The next part I can think is she will be the main person who will be bringing preventive aspect into the care. We always talk about preventive aspect along with the curative aspect, but we feel that every hospital we always promote the curative, the preventive is always given a backstage. But I am sure that the nurse in future be a leader for providing preventive care to the patient, maybe through the home care or maybe through a nurse-led OPD or through a nurse-led community center. Anything can be there, but she will be a person who will be focusing and bringing preventive aspects so that the admissions have been reduced and the patients and the relatives are more and more happy. Again, I just would like to emphasize that today we all, especially the entire health force, is being afraid of what has happened in Calcutta. So now, and not only Calcutta, across the globe, now mainly my nurses, whom I think that future will be a safety person who will be looking into the well-being, mental and physical well-being of the whole healthcare worker in the country. So that what has happened, no such incident of Calcutta will repeat in our country. So I see or foresee my nurses who will be in front to looking into those particular things. Of course, along with this, the latest, she will be a torch bearer for AI as well as data revolutionary things and all. So overall, what I feel, nurses are going to play a vital role in the future of our healthcare system, and where every hospital, whether it is private or government, they can expect a better outcome and the patient satisfaction. And I just support the last session which has completed over here, that is the patient-centered or patient involvement, where the patients and the relatives will be involved in the care. Thank you.
Thank you, Ms. Mathai. Very inspiring and really critical point around the role of nurses in the future. Dr. Shetty, I'll turn it over to you next. Would love to hear your thoughts on clinical protocols inside the hospital, outcomes tracking. How do you see all of those evolving in the hospitals of tomorrow?
Thanks, Abhishek, and good morning to all of you. It's indeed a privilege to be a part of such a distinguished and diverse panel here today. So when we talk of accreditation, when we talk of value-based care, one of the key cornerstones or foundation of this is clinical outcomes. And what accreditation lends itself to is standardization and consistency. In some of the earlier panels, we discussed about how, with the rising life expectancy, we have more and more patients living longer, they have more comorbidities. So how do we ensure that there is a very standardized way of treating them? And clearly, accreditation lends itself to that, because what it means is that we need to track outcomes, we need to measure outcomes, and we need to share outcomes with various peers as well as bodies like NABH. As they say, what we can't measure, we can't improve. So this obviously puts in a process of self-improvement, where physicians, nurses, various interdisciplinary teams work together to focus on outcomes. And when I talk of outcomes, I don't just restrict to clinical outcomes, but there are various other patient-related outcomes prompts, patient satisfaction measures, and other measures such as readmissions, return to ICU, return to operating room. So all of these are very, very important measures that we track on an ongoing basis, because these reflect the quality of care that is being delivered. These reflect the outcomes that are being delivered. So clearly, standardization is one of the critical elements which lead to better outcomes, because we have consistent processes which drive that. Secondly, of course, a lot of focus on patient engagement and patient safety. I think the first session we spoke a lot about patient engagement and how patients and family members need to be a part of the process. They need to know exactly what's going on, and physicians have to be trained to make patients as part of the treatment process. So clearly, patient empowerment was a word that was used, and I really like that word, because the patient of today definitely is more engaged and more empowered. And if you make him part of the process, that itself is going to improve the patient outcomes. The third very, very important aspect of it is the digitization. So clearly, as we move forward, I think use of technology is going to play a very, very critical role in patient outcomes. So clinical decision support systems, telemedicine, because a lot of care is going to start moving out of hospitals. As Dr. Agarwal rightly mentioned, when we talk of home care, when we talk of telemedicine, there has to be seamless flow of information across all these agencies and all these levels of care. Similarly, when we talk of transfer of care from one environment to another, I think appropriate information needs to flow seamlessly from one entity to the other. So digitization is also going to play a very, very critical role in driving outcomes. And of course, technology. I think one of the paradoxes always remains that, okay, hospitals are investing in more and more newer technology. There are robots, there is lab automation, there is artificial intelligence, and isn't this going to push up the costs? And that is where I say that value-based healthcare clearly comes in, because these are technologies which will enable one to get the diagnosis timely, correct, much earlier, reduce length of stay, reduce infections. All of these are very, very important aspects as we move forward for the hospitals of tomorrow. And clearly what we need to build in also is a reward, recognition, and an incentivization mechanism, whereby today we see providers who are being given higher reimbursement rates if they are NABH accredited. What we've done at our institutions is also to build in a reward and recognition for physicians who give better outcomes, whose patients have lower infection rates, whose patients have lesser length of stay. So clearly, I think all of these are going to play a very, very critical role as we move ahead to the hospitals of the future. But we definitely have very interesting and exciting times going forward, and quality, patient safety, and accreditation are going to be very critical. Thank you.
Very, very powerful, Dr. Shetty, and I'll come back to a lot of your points when we recap. I think I have an assignment for all of us as a result of what you said. Ms. Nevatia, would love to hear your thoughts on the multidisciplinary nature. Multiple panelists have referred to it, so would love to get your thoughts. Also on partnerships of hospitals, right? Because it's an ecosystem approach for healthcare. So how should hospitals be thinking about partnerships with other stakeholders in the healthcare ecosystem? Would love to hear your thoughts.
Thank you, Abhishek, and good morning, everyone. Really great to be here. I'll just build on a few points my colleagues have spoken, but I just want to first start by saying that today's meeting is all about patient safety, and that really starts with patient centricity. And why I bring that up is, if you just imagine, many of you are from hospitals, your patients are probably coming from all around that place. It's not just from that city. And when they walk in most cases, the hospital is relying completely on the patient to give them the information about his or her medical history, his or her medicines that they're on, his or her, kind of the side effects they've seen. And that, especially as our people are getting older, that is quite a huge responsibility we put on patients. So I want to start with that, which is this whole need to have a 360-degree view of our patients, of all of us actually. And whether it's through electronic medical records, I know we have a lot of proponents of that here as well. But everything about us is there on our Aadhaar card, but nothing about our health profile, our, the medicines we are on. I think of my own parents. If you ask them what are all the medicines they're on, they don't really know. They know it's on a piece of paper, they do it every week, they fill their pill box, but if you ask them offhand, they wouldn't know it. So I think that's the first piece I feel is very, very important, having that 360-degree view of the patient when they walk in, and how can we facilitate that through whether it's electronic records or hospital keeping their own system. But very linked to that is the multidisciplinary approach. I think Ms. Ramani talked about it for dementia. We, from where I'm working, we see it in areas like oncology, we see it in areas like, even in the case of dermatology, definitely in pediatrics, that the importance of designing the hospital around the patient instead of designing the hospital based on the functional areas, cardiology, neurology, nephrology, it's diabetes, they're all separate, but the patient is the same. And very often the patient then gets referred across the hospital. You can imagine what happens to patients. They don't always go to all the different centers. And unless it's for preparation for surgery, the patient is really just going to one therapy area and walking back. So I think that whole multidisciplinary approach to patient, how do you see, put the patient really at the center of care? It's much easier said than done, I know, but I think that is probably the most important thing. And whether it's through digital means, whether it's through the design of the hospital, whether it's through having hospital patient buddies, I've seen that in some hospital where there is a patient buddy that guides the patient around. It could be electronic as well in the future. I think that would be one big theme I wanted to just bring to light. The second area is, it's unrelated. This would be great to have. The second area I think is an absolute must-have, which is antimicrobial stewardship. And we've been fighting this cause for a long time. We have a portfolio in this area, and unfortunately or fortunately, India is one of the largest consumers of our medicines, and we're not proud of it, because the reason for that is it's in many cases additional use, it's in many cases overuse, it's in many cases when we go around the hospitals, not the leading hospitals probably have it, but not all hospitals have the microorganism profile of their respective unit at the level that they need to define their anti-infective policy. And I think that is an area, I mean, there are many hospital CEOs and, kind of associates and leaders here. That would be my biggest ask really, is to go back and look at how much energy are you focusing on the antimicrobial stewardship in your hospital? Have you really controlled the use of anti-infectives? Do they always use, I know sometimes it is you save the best for last, but in the process, do you lose a lot of time? How quickly are the results available? Sometimes it's taking 48 hours, whereas for most patients in ICU, they don't have that kind of time. So I think this is really a ticking time bomb. It's like a pandemic of a totally different proportion. And I just feel somewhere it needs to really get the same attention as we were able to give areas like COVID. So I think that would be my second plea, almost like an ask to say, while we should do many things to have this visionary view of the patient at the center, but at the bare minimum, the antimicrobial policy of a hospital is extremely important. So those would be two ends of the spectrum. I think the third thing to Abhishek's point about partnerships I would add is, clinical research. I think you started, Abhishek, by saying what can India do for the world? And many of you spoke about it, but clinical research, honestly, there is no better ecosystem than our hospitals where the best quality research can be done. It doesn't always have to be initiated by pharma companies or medical device companies. It can be very often initiated by the hospitals. And when I look around the world, some of the best leading hospitals in their fields do a lot of their own research. And what does that do? A, they are just generating data which can go into insights. It attracts the best doctors, clinicians, researchers to your hospital. It also creates a much bigger halo effect for patients as well. So it's not just a nice to do to invest in the science, but I think the insights that can come with it, the way you can attract doctors and physicians to your hospital if you're doing research, can be quite, kind of a multiplier in so many ways. So that would be the third area I think to touch upon. I know we're at the tip of the iceberg, in terms of how many hospitals can be clinical trial sites. But I think that would be a good vision to have for a hospital as they move forward, to really bring that science to patient care in a very, very tangible and kind of impactful way. So those would be the three areas. But if you just take one message from this, I would say antimicrobial resistance would be the biggest one, because that is harming many, many more patients than we realize. Thank you.
Thank you, Meenakshi. And I think the AMR topic is not talked about enough. So that completely resonates. It's a very invisible epidemic, if you will. So completely agreed that there needs to be institutionalized focus around it. Dr. Deepak, you've been a big proponent of digitalization. I know it's a topic of interest and passion for you, so I'll turn it over to you, both in terms of digitization of healthcare records and services, but also digital delivery of healthcare. Over to you.
Good morning, everyone. Thanks, sir. Thank you, NABH, for giving me an opportunity to actually speak my dream, to speak in front of my mentors. So let us think we are standing on 17th September 2047. When our country is Viksit Bharat, we have attained our goal. But can we really attain our goal without having all healthy, and where health hazards are discussed as a thing of past? Let's say when NABH celebrates in 2047 Patient Safety Day, the agenda should be a historical perspective of all the harms, where we can say from our heart that as healthcare workers, we do not contribute to any of the harms which we, today at least, we can't say. And we know how much harms we do to the patients, as Madam had already said, by using antibiotics, by using medicines which are not required, and by having all kind of data which sometimes is not the single source of truth. So once digitalization takes place, I can be very sure that we will be dealing with only single source of data, and the energy which we are spending on collecting papers and filling all the data, and sometimes most of the data is never reviewed also. So let it be left to the automation, let it be left to the digitalization. Let us give more time to our healthcare workers to do what we are meant for, to talk to the patients, to talk to the families. If nurses, doctors, and all the technicians are free, where they have a data-driven decision, where they don't worry about going through all the papers, that will give us a lot of opportunity to talk to the patients, and patient will be the customer as the king. At every touch point, his experience will be captured, where everyone knows he is accountable for each and every talk he makes, where patient enters the hospital with a full faith that I will be given a safe and a humane, empathetic patient care. Another thing which I want to point, that we do talk about patient safety all the time, but to ensure patient safety, as Madam Gracie has already said, we have to ensure safety of healthcare workers, their mental health, and I'm sure in the coming times, with the help of AR and VR assisted, a lot of programs, doctors and all healthcare workers can be ensured that they live a stress-free life. Because only a pot which is full of happiness and satisfaction can spread to others. We all know how many healthcare workers are under stress, suicide rates are very high. So unless we take care of all these things, I'm sure we are talking a lot of theoretical things. The documents which we create, they normally don't lead to the decision making. So we should be talking of big data analysis, which will lead to a good decision which is based only on the data, not based on any biases. So that will lead all the managers, everyone, to make the right decisions. Advent of ARs and VR will help patients to experience digital twins of the hospital before they actually walk into a hospital. They will know exactly what kind of a hospital he is dealing with. Accessibility. India is a diverse country. And if digitalization is done, it will bring the healthcare at the doorstep of everyone. We are a country which has a very high penetration of smartphones, and with this ABDM and all highways being driven, I'm sure the future hospitals, once they are driven with this digitalization, with that automation, our medication management, like we should not be discussing medication errors. We should be discussing all these things in a historical perspective, that there was a time when this and this mistake could take place. There was a time when healthcare worker had to spend a lot of time in patient identification, when simple barcodes and a lot of things can be done in a food or in a showroom these days. I'm surprised why we are not doing it completely today in the case where a single error can lead to death of a patient. It is very surprising that shoes and clothes are sold with all barcodes and RFID tags, where where human life is so important, they keep waiting outside and nobody even tells the technician that so-and-so patient is vulnerable, help him out faster. So I dream of a hospital where when the patient comes, he doesn't have to inform anyone that I'm a VIP or anyone. His condition, his vulnerability decides his diagnostics, his prioritization. When during assessments, all the KPIs are driven by the data, the people can see directly, they can do all the diving in the data and come to a conclusion. It will be a kind of a very great thing. We are entering into a robotic systems and all, and I wish the time when all safe surgery checklists, they lock all the robots, and without filling those checklists, the systems cannot operate. So that nobody have the luxury or doing it later on. All the checklists should be by default allowing the next steps. So if these kind of future hospitals are there, where patients, and not only patients, even the healthcare workers are the center stage, where we take care of all of them. There is a strong access control. So there is no mob which can enter the hospital like Calcutta. And these are not something difficult to do. It is only the thinking, like just now NABH has done something, they took a photograph, and before the session is finished, the photographs are there and then. So it is the decision making and implementation which is the need of the hours. And if we want to really achieve that, our 4 pillars of patient care, do not harm and autonomy, then digitalization, automation should be there as a part of our future hospitals, so that doctors and all healthcare workers are left to do what they are supposed to do, talking to the patients, because these days he feels that he is not being talked to. He doesn't understand half the things which we are in a rush to fill all the documents. So the bottom line should be nothing about me without me. That will be the day when the future hospitals will mean a lot, and what we are gathered here today will be the real thing. Thank you very much.
I think, I'm not sure we have time for audience questions, but I just wanted to thank all the panelists, because it was both a very bold vision for what hospitals of tomorrow can look like, but also a lot of specific ideas. So on behalf of all the panelists, we have one specific request. You've taken a lot of effort to come here. You're spending your day here today. If there is one idea from what has been discussed in this panel that really resonated with you, be a champion of that idea. Go back to your hospitals, have those conversations, build that coalition of the willing and put it into practice, such that many years from today, we look back at today and say, hey, that was the beginning of the hospitals of tomorrow. Thank you so much, everyone. Thank you so much, the panelists.
Thank you so much, Abhishek Gopalakji. Just 1 minute we will take from all of you. And I will request Rizwan Saab, our chairperson, and Dr. Atul Mohan Kochar, CEO NABH, to please come on stage and present a memento to all the panelists, along with the photo frame, जिसमें अभी की इस मोमेंट की फ़ोटो को हमने कैप्चर करके उसमें फ्रेम किया है, ताकि आपकी मेमोरीज़ में वो चीज़ें हमेशा रहें. So आपकी तालियों के साथ हम इनको थैंक्स कहना चाहते हैं. We are grateful to all the panelists who participated in this session on hospitals of tomorrow. Dr. Kaustubh Upadhyay, Srimati Gracie Mithai, Dr. Anurag Agarwal, Dr. Santosh Shetty, Srimati Meenakshi Nevatia, and Dr. Deepak Singla. and Abhishek ji moderated this session. So the time constraints was there, लेकिन फिर भी उसमें बहुत सारे ऐसे कुछ इंपॉर्टेंट बिंदु जो है निकल कर आए हैं जो फ्यूचर के लिए हम सब के लिए एक गाइडलाइन की तरह होंगे, एक इंस्पिरेशन या मोटिवेशन की तरह होंगे। और इस रूप में पेशेंट सेफ्टी से शुरुआत करके हॉस्पिटल्स की क्वालिटी और उसके एक्रेडिटेशन बेंचमार्क्स उस तरह के मेंटेन करना, जहां पेशेंट आते हुए घबराए नहीं बल्कि एक ट्रस्ट के साथ आए कि उसको एक अफोर्डेबल और क्वालिटी सर्विस जो है उसमें ट्रीटमेंट के रूप में या किसी भी रूप में उसको मिल पाएगी। तो थैंक यू वेरी मच टू ऑल द पैनलिस्ट इन दिस सेशन ऑन हॉस्पिटल्स ऑफ टुमारो, अ यूनिफाइड विजन फॉर हॉस्पिटल्स। We have the next session just after this second session, that is based on quality and accreditation. उस पर हम इस चर्चा को जारी रखेंगे क्योंकि these are the different aspects of the patient safety and health sector में अलग अलग उसके dimensions हैं जो बहुत important हैं, और उसी दिशा में एक टोटलिटी में जब हम इसको विजुअलाइज करेंगे, उसको समझने की कोशिश करेंगे, तो सभी का गोल एक है कि इस देश में हेल्थ सेक्टर को इतना बेहतर बनाया जा सके कि विकसित भारत में ये सेक्टर अपनी बहुत महत्वपूर्ण भूमिका निभा सके, क्योंकि हेल्थ एंड एजुकेशन दीज आर बोथ द बेसिक सेक्टर्स, जबकि विकसित भारत की हम सोच लेकर आगे बढ़ते हैं। तो इन सब का बहुत बहुत धन्यवाद, बहुत बहुत आभार। और